I've learned a lot from being on that committee. And Marshall Watson, the head of petroleum engineering, he was in the real world before he came to academia, and I really like the way he approaches conveying information. But the likelihood of any fracking being done in Lubbock is minuscule, like 1 in a million chance, because the geologic formation in this region does not require fracking.
That's probably true, and I also know that what we're talking about is, unfortunately, is the city of Lubbock. Because what we really are concerned about is the whole county and counties around us. And I think that's why it's important to get the message out that this is not just a Lubbock problem. And Lubbock's going to be dependent on what's going on around us.
This same argument's going on everywhere.
Yeah. And we need to just put it out there and get it to the people and say this is a serious, serious problem. And we're just sitting back and we can't think it's just Lubbock. We've also almost had to tell the city council they've got to get together with lots of other city councils and county administrators and stuff. I guess the county can't do much, as I understand it legally.
Right.
It has to be cities. But they've got to get together. They've got to think about getting together and working as a group. Not just, as you said, just here's Lubbock, this little tiny place right here. And that's not going to work. And I think that message has to be.
Well, I'm glad we got you guys to put something together that we can translate down and make it understandable. Yes, David.
Point of information, Mr. Chairman. I'm on the committee with Professor Audra Morris of setting up the Fracking in Texas conference that will be held at Texas Tech the first weekend in September. We are actively seeking people that speak and have sections, and this might be something that we could address in that meeting as a section for city responses to fracking as well. Obviously, petroleum engineering is big in this, and they have a particular point of view, but we're having a very balanced meeting, so I would make sure that that was in your minutes, and I'll be happy to address more along those lines since I'm on the organizing committee of the FIT meeting.
You better watch out. We're going to have to appoint you to the board.
Fortunately, I live in Smyrna.
Oh, darn. All right. Anything else, Dr. Epstein?
I should mention that another motion that failed was a requirement for a well inspector.
Wow.
Which was the real core of our recommendation, so something that we want to make sure and continue to champion. All right. All right. Well, those are the two big action items. That's good. We've tried through that. And now we'll kick over to Mary, and she can tell us about communicable disease updates.
Okay. Enteric diseases numbers were a lot lower than the expected range. We've had very few enterics. I don't know why. Maybe just not being reported or tested. For vaccine preventable diseases, we only had 9 cases of pertussis in January, so those numbers have come down significantly. We did have 1 case of malaria, but this person had foreign travel. He is recovering. It was falciparum. It was from West Africa.
Wow.
We were unable to get the numbers for tuberculosis from Department of State Health Services. We had 6 strep pneumo invasive diseases with no deaths, and we still have had no pertussis deaths.
Any questions?
Yeah, Mary, where is do you have any numbers on the H1N1 influenza A?
We do not track flu numbers. It's not a notifiable condition.
I know it's not, but it's nice for community's sake. Nice to have those numbers, though.
We haven't been getting those. The State Health Department has been informally tracking the numbers and have not been sharing those with us. But if I'm able to get those, I'll present them at the next Board of Health meeting.
Mr. Chairman, thank you, Mary. I think that's important as we go along. I'll tell you what happened. 2009 was the last epidemic we had of H1N1 and flu, and we did well the last 3 years. This year was very horrific. We lost, I don't know, somewhere between 8 and 10 people from H1N1. What is sad is $10 would have prevented these deaths. $10 vaccine. And these are not elderly people with multiple medical problems. These are young, healthy people otherwise. And it was sad. Our ICU was just full of H1N1, intubated on ventilator. So I just felt like, as a city health department, I don't know what we could have done, what we need to do, but I felt like we should do more. I don't know what it is, I'm just bringing that up because I feel strong. It's fading away, the H1N1, we haven't seen any case in the last week. I think we're okay right now, but for the next, before we get to the next year, I just want to put this on the table. Please think about it. There's something we need to do. We need to educate more, and we need to do more. I don't know how, but we got to do more. These are preventable deaths.
I continue to see a slow rate of vaccine refusal in my clinic practice.
Why is that, Ann?
They don't want it. Generally, the patients typically express anxiety about the side effects of the flu, of the flu virus, things like, I hear it has bad side effects, I hear it's bad, or it's, and sometimes the anxiety is palpable despite no reason given. What I will say is there are a number of people who are anxious about vaccination and who are afraid about the side effects. I think they're not opposed to not getting the flu, but they often say things like, well, I've never gotten the flu. Mm-hmm. And then they tell me about the side effects they're afraid of. Or they say it's bad, appealing to a general authority in anti-vaccination movement.
I hear that, I'm with you, Ann, but if we spend enough time explaining, not everybody will take it. A lot of them
would
take the vaccine.
This is an education.
Question of spending little time and explaining it. We physicians need to do a better job, in my opinion, and we need to do a little more education as Department of Health before we get the next season. This was pretty bad season, Mr. Chairman. Mm-hmm. We lost a lot of young healthy people, and there's no need to.
I think it also sounds like we need to do something proactive from the standpoint of taking on this anti-vaccine group and talking about the scare tactics that they've used and the false information that they're using for this, because this is a nationwide thing, of course, and at least for Lubbock, we have to show that the data shows that all these supposed problems are not real. And in fact, there's been careful studies done to refute all of these scare tactics that these people were using. They were claiming it could cause anything from Down syndrome to just about anything else. And these are not, they don't correlate with people that take the vaccine. People do get these things, and it does happen, and you have children that have problems, but when you look at the statistics, they don't match up. And I think it's important that we try to be more proactive in helping to alleviate the anxieties that Ann's was talking about, because I'm sure as a parent, you want to be conservative, you want to be careful with your kids, and so you tend to err on the side of being a little too conservative. In fact, we should say the conservative approach is to give them the vaccine, because we have, as you said, we have deaths right here in Lubbock.
A
lot of deaths. And that's worse than, these are real statistics that we have to get out there.
Okay, let's go down the line. Dr. Presley, go ahead.
Along those lines, and just as an example, and it's not, and I agree, education or getting information out is important, but as Becky can vouch for me, for several years I would pay to have the nurses come out and give shots to anybody at Tide that wanted one, but I would pay for my lab group. And with 11 people in my lab group, I typically would pay for 2 or 3 shots.
Really?
And these are educated, either master's, PhD students, or even, these are educated people. And it's not because they're worried about side effects, or at least what they voiced to me. It's because they don't ever get the flu. Why should I do that? And so I don't know what the answer is. I just throw it out that it's not an ignorant or an undereducated population that does this. Also, what I originally was going to ask about is, so the Region 1 epidemiologist doesn't provide you information on flu results?
Well, it's an informal
Sporadic.
surveillance. So it's not a requirement, it's more of a sharing, and when you have time instead of things that are.
Well, and why I bring that up,
You know, it's not a, I'm not going to tell you thing. I think he just hasn't had time to compile the numbers and
well, you know,
type of thing.
we do the flu screen for all the Sentinel hospitals, all the Sentinel labs in the region, and we send in a report every week.
I get it.
Yeah,
And
that report we do, yes.
okay.
Yeah. But
Part
as
of the
far as
problem
the-
is the Sentinel labs sending us samples. So if y'all get suspected flu, send a sample. You know, so the procedures for Sentinel labs to send samples from Covenant, from UMC, they're all considered our Sentinel labs, but getting compliance by Sentinel labs is a big issue.
Okay.
So what is the funding? I mean, who pays for that? If I culture my patient, I think they have the flu, and I should send him to your lab. Is my patient's insurance likely to cover it? How much is the cost?
It has to be we have to get it from recognized Sentinel labs. So it's like hospitals and some clinics. I don't know about private practice. We don't charge anything. We get them in and we run them.
I believe, Dr. Epstein, if that is something you're interested, if you want to be a Sentinel lab, I believe the state will work with you where you can be.
Okay. So I've had bad experiences with trying to get cultures on other diseases. For example, pertussis. I try to get I try to culture the patient for pertussis, and the lab had a fit. I mean, they were very excited. I had to fill out all these forms, and I had to do them in double, and then they had to send special tubes to me, and then it turned out I couldn't send them locally. I had to send them to the state, but then nobody would pay the state, and I tried to send it to the state once anyway, and they told me they didn't do it. The sample was lost. And so there proved to be no usable mechanism to get my patients tested for pertussis.
Of all things.
But now, don't the labs do just PCR testing, or do you mean an actual
No,
culture?
I tried to get something through the commercial lab that I use in my private office, which is CPL, CPL Laboratories. And they sent me a little tube once, and I used it a couple of times, and the sample got bounced around, and nobody would analyze it, and I gave up.
We get in flu samples all the time. I mean, daily.
And we have free
Okay.
test kits we can give you.
Wonderful. Thank you.
We did solve something here.
Good. Okay.
That's information we should get out to the public.
Yeah.
Clinicians.
Yeah, to clinicians.
Yeah.
One of the issues that comes up again and again is the education issue. We keep saying we need to educate the public on fracking, on pertussis, on flu, but we don't have the ability to do that. We are an advisory committee to the city council. Maybe we should look into revising what this board does, because it'll be a perfect place to develop this kind of education with the kind of people we have on the board. And I see this as very valuable to the city, the citizens, but as it is, we can't do that.
Well, it certainly emphasizes why we all support the health facilitator as a starting point.
Yeah, is that person started yet?
We haven't even got it approved in the budget.
Yes.
It's not approved in the budget?
Oh, no, it'll be
We're just
fall.
now starting budget.
But again, see, it's one of those things where the important thing that I think we've all learned on this board is you got to stay after it. That you just can't let it disappear somewhere. We have to fight for it. And so I think as it next budgetary cycle comes up.
But that person won't be able to do everything. This
Right.
board could do so much and could contribute so much if we had the ability. So
I think it's
we really have to look at changing things and maybe presenting to the city council and say, come on, let's use this Board of Health appropriately.
Yes, I think it's an excellent idea. And let me percolate on that. Maybe we can form a committee and kind of think about it. Okay. Anything else for Mary?
I strongly echo that sentiment. Thank
Yes.
you.
Well, and I just want, if I can have a minute and just address Dr. Chikuru, I can't tell you during this flu season how many times I have been interviewed by the media. I have been on the radio. I know I was on the radio 2 to 3 times a week when I knew there was lots of cases. So, and we, just so you know, when we got our flu vaccine this year, we did not make not 1 penny off of that vaccine. We just charged enough to pay for the dose. We didn't get any reimbursement for syringes, for staff, for anything. We only charged enough to pay for the dose of flu vaccine, so we kept it very inexpensive. So we try to do, keep it at a cost where citizens can afford it, and we are educating. And I know that you know we're educating, but I don't know that you guys know just how much time we spend educating.
Thanks for doing that.
Yeah,
Yes.
excellent.
We spend a ton of time.
Excellent. Anything else? Seeing nothing else then, let's move into our one action item. We need to approve our January 17th, 2013 minutes. Do I hear a motion to approve? So move. Second? Somebody? Okay. All right. Any other business before the group? No, a very productive meeting. I think that we solved 1 or 2 problems and we mashed our teeth about the others. So, all right. So with no other business before us, we'll adjourn. I'll see you guys back here in March.
So,